Good evening, everyone. We, the healthcare professionals, designers, and engineers of the Ascend Corporation, are happy to present to you the Stabilizer, formerly and dumbly called the Grip and Slide. Now, next slide, please. So, I saw someone tweeted earlier from the Hunger Games, may the odds be ever in your favor. And let me tell you, from a health system perspective, the odds most certainly are not in our favor. Senior citizens are a high burden on our system at the moment. And the highest 10% of users of our system account for over 60% of the healthcare costs. So that's a very small proportion of these people who are accounting for over 30 billion of our healthcare system dollars. And so what we need to do is to find a way to stem the tide. And that's what the state is at the moment. There's no telling what will happen once not only our grandparents' generation moves on, but when our parents move on and become seniors themselves and need care. So what we need to find are opportunities to take the manageable and avoidable costs and manage them and reduce them to help take control of our system. And Vanessa is going to tell you more about that.
Greetings, everyone. Thank you, Randall, for bringing it from the policy and the system view. I wanted to just share that everybody in this room, whether you are considered a senior yet or not, we are all going to become seniors. And in Canada, the stats go around from 65 and up. To give you an idea where we are right now, there are 5 million Canadians 65 years or older, and the World Health Organization projects that by 2050, most of us will be seniors, and we're looking at 2 billion people. I'm not going to read through the slides, but we've got lots of stats here. Most prominently, 1 in 3 seniors falls per year, and once you hit 80, that reaches 1 in 2 seniors fall at least once per year. That means that 1.3 million falls in Canada each year, and that 20% of those that get a hip fracture end up dying in the hospital usually. 51% of these happen in the home, and the main reasons are tripping because of tripping, stairs, and getting in and out of bed. What's important now is the solutions that are on the market are very reactive, and so that means you've already fallen down the stairs. We all remember that Made It on TV commercial, fallen and I can't get up, canes to help. The other piece is that they don't deal with comorbidity when there are different challenges that seniors are facing already. So you may be getting a pill that's making you dizzy, and then as a result, you're not stable on the stairwell. What I think is also significant is that the risk factors are environmental, health, and behavioral. But in each of these buckets around the center, they're all pointing to environmental conditions. And that's what we need to look towards, solutions that are going to create age-friendly environments.
Okay, so what do we have when we're going down the stairs? On the left side there, we've got the current hand grip for many common railing designs. And as you can see, they all have the same sort of horizontal type hand position. So what we've come up with is a system that goes over top of your existing railing and augments your hand position. It's designed in such a way that it interacts with the web of your hand to create a more comfortable position when your hand has your thumb interlocked and your fingers around the back. So by doing that, we've put the person in a position that they can correct themselves from minor slips and loss of balance by having their hand in the correct position. So with that, we went out to the public and we asked them to try out our product. And what we found was that 73% of customers said that they liked the new hand grip that we were presenting to them. In fact, we have one quote from a woman saying that my grip felt safer on the new banister. 23% of people showed a learning curve. And that's actually in part of the product because it's designed to be uncomfortable if you're holding the banister incorrectly. So people have a natural tendency to move from discomfort to comfort. That drives their hand into the correct position. So we've selected materials for going into the markets of facilities that are plastic and hydrophobic and assist with grip. Did you have anything else you want to? Yep.
So in terms of the value proposition, what we're looking at here is essentially by avoiding falls, what we can do is avoid visits to the ER, which cost $800 per day. So with every avoidance of this and at a cost of only $6 per foot, We're essentially substituting, avoiding costs, giving people a better patient experience, better quality of life, and independence. Thank you. Sure.
Thanks very much for the presentation. So what I think I heard you say is that your solution will save the medical system money, in addition to obviously saving individuals a lot of pain and grief. Who do you think will end up paying for it, the medical system or the individuals?
So I come from management consulting and healthcare, and this kind of design and issue actually came out of discussions that I've had with clients. Because one of the biggest issues for them is part of their service level agreement is tied to metrics around falls, deaths, and ER visits of their patients. So a lot of it, our penetration strategy enters through long-term care facilities. So those are the ones who are paid directly by the government to provide home care services. Another issue is if people want to do it in-home, the ministry even prioritized that as part of their senior strategy, so much so that they created a tax credit called the Home Health Renovation Tax Credit, which specifically gives a tax credit if you modify your railing to help you make a safer environment for you to age at home.
In addition to that, as you know, these priorities are aligned with research priorities, and that is part of our strategy in towards building up the health outcomes and indicators to help along with the collaborative research objectives. Yes.
What kind of science went into the manufacturing of the specific rail? I mean, I assume you weren't just guessing at a position that works for this.
So we started out with several different concepts, and what drove us towards this was it was an iterative design process. So we wanted to select something, materials and design that could go onto the existing hand system, so that we don't have to go through replacing an entire railing system and go through building product certification. Making an additive item that goes on that fits sort of the target 60 percentile female, 90% male hand allows it to be comfortable for everyone. So by the selection of materials, what I didn't get to in the presentation was we want to use surfaces such as silicone that have a hydrophobic coating on them. If you've been listening to the news right now, Princeton has an outbreak of meningitis. Meningitis is a liquid-borne or a fluid-borne virus. And so if you have a hydrophobic surface on something that is a common item where everybody's touching it, it will keep disease off of it and stop the spread from transfer from one person to the other. So the shape, you're welcome to try it out if you'd like to put your hand on it. It's a going down ramp if you're on that way. So yeah, that's correct. You put your hand right in the exact same position.
So one other thing to note is that we actually surveyed practitioners. So we're talking about doctors, occupational therapists, and nurses, and asked them what were the leading causes of falls downstairs. And they considered all of falls downstairs very serious to fatal. So we asked them what is the best way to prevent those things, and getting a proper grip on it was the most important thing that they identified. Second was illumination, so there's a lighting feature, touch lighting feature on this as well. And essentially, we designed it around establishing the proper grip, because currently the way that seniors walk is they tend to slide their hand over it the same way that most of us do, but they can't have that confidence.
It's partly to do with over and under familiarity with the stairwell. So if you've lived there forever or it's a new stairwell. The other added component was that we focused on human-centered design and grounding it also in the existing literature around stair falls.
I think you've done a great job demonstrating there's a need for this, but what about market size? Like, how many of these do you have to sell to be able to make a business around this?
Sure. So in terms of the facilities themselves, so a lot of these facilities, especially with long-term care, you have residential homes, you have assisted living facilities, and you have long-term care. So long-term care facilities are more for the ones who need nursing assistance and things like that. They're the ones who need assistance just getting around, so it's probably not as much for them. But with residential homes and assisted living facilities, they're one of the few parts of the healthcare system that are still growing because of the ministry's strategy to move care into home and long-term care. So they're trying to free up hospital beds and things like that. In Canada, it's an incredibly large market that's been growing 8% over the last 10 years. We think about the United States when we're moving forward. Getting Medicare and Medicaid approval for this, which only requires proof that it's needed by sick people, it is something that improves their quality of life, in addition to a few other kind of criteria, which we found that we all fit, and validated with one of the mentors who has an assisted device. That market alone, we can take an easier route. So if you've ever watched the United States commercials where they say, do you need a electric wheelchair? We can get you one for free if you're eligible for Medicare and Medicaid. Because what they do is they essentially bill Medicare, Medicaid, and they just distribute it for free. So if we even contact kind of like a reseller like that, it's an easy, cash inflow. So the American market is incredibly large, and private insurers are even more incented to avoid falls.
I think what's really important is that this is preventive, and that it can be a global market where there's old people everywhere. Another thing that I want to drive home. Another thing that I want to drive home is that as we age, it doesn't necessarily have to be considered always a cost factor, and seniors can really bring back, contribute a lot of wisdom and life experiences, and that's why we're looking at aging in friendlier environments. Another small thing that I'm going to add again is that around the world, seniors tend to have poorer health conditions when they grow up in lower socioeconomic statuses. So whether it's in Canada, you could look at a neighborhood, and people who are growing up in poorer conditions are going to have more of these falls. But in the world, you can imagine where there isn't the infrastructure that we have, this is more impacted by, more felt by women also. So this is something we don't have all the answers, but in the long term, looking at expanding to different markets, and I'm personally very interested in gendered health and global health, so this is something that we're going to be looking at.